For more than 47 years, our nonprofit, Resources for Seniors, has supported older adults and caregivers in Wake County. We can help in many different ways, including adult daycare programs, ramps and repairs, in-home supports, and consultation and referrals. Indeed, we're who to call when you're not sure who to call. Resources for Seniors stands ready to support you in your caregiving journey.
I'm Mark Costley, the founding attorney of Clarity Legal Group, the Triangle Area estate planning and elder law firm. You know those people who become overwhelmed dealing with the multiple challenges of being a caregiver? Clarity Legal Group helps people establish legal tools that avoid confusion, give them peace of mind, give them asset protection, and in some cases help them qualify for Medicaid. We help people get it right in the face of some of life's most important challenges. We don't just provide wills, trusts, and powers of attorney. We provide solutions and ongoing support. We provide clarity and peace of mind. It would be a privilege to help you.
Are you like 80% of seniors who would like to age in your current home? Call Wisdom Senior Care. Are you currently taking care of a loved one and finding yourself frustrated, tired, and even lonely? Call Wisdom Senior Care. Always available, dependable, and flexible. Come partner with Wisdom Senior Care, keeping wisdom at home.
Hello, and thank you for joining me today. The topic of my presentation is family dynamics, breaking barriers to healthy communication. Wow, that's a topic that we could talk about for days on end. My goal today is to provide current and future caregivers with resources, information, tools, and tips to help you have effective, successful communications with your loved one, family members, healthcare providers, and others. And I also want to acknowledge all of our caregivers for what is, without a doubt, one of the hardest yet most rewarding seasons of life. My name is Vivian McLaurin with Preferred Living Solutions. I'm a geriatric care manager, also known as an aging life care professional. So I'm a geriatric care manager. What do? I help families navigate and manage what can be overwhelming responsibilities and dilemmas associated with caring for a loved one. As a care manager, the first thing I do is listen, and then I help you make a plan, manage the crises, and hopefully ease the way. So as an aging life care professional, I'm a member of a national professional organization called the Aging Life Care Association. aginglifecare.org. That's a bookmark you might want to make a note of because that website is filled with resources for caregivers and can help you find a care manager in your local area. As an aging life care manager, we adhere to a code of ethics and a set of standards. As a care manager, we have expertise and the ability to coordinate and facilitate across 8 knowledge areas. Perhaps the area that we work in the most is crisis intervention. So I'm not going to spend much time today on numbers and statistics. However, since this is the Caregiver Summit, I want you as caregivers to know that you are not alone. Last year, 43.5 million caregivers provided unpaid assistance to an adult or child. In 2018, 16.5 million caregivers provided over 18.5 billion hours, yes, billion hours of unpaid care. And sadly, in the United States, people are living with Alzheimer's diagnoses more than ever. Currently, there are 5.8 million people with an Alzheimer's diagnosis. And sadly, that number is expected to increase to over 14 million by the year 2050. There will be a need for caregivers that is greater than even now. So this could have been a picture of my mom and dad celebrating a holiday occasion. All is well until it isn't. A crisis occurs, and family members are asked to step to the caregiving plate. Perhaps in this presentation today, the best advice that I can offer to you is to make a plan. Make a plan and hope that you never need it. Gather information, professional experts, contact information so that if and when a crisis does occur, you have information and resources to help you through a critical time. So, a few years ago, I created a mnemonic called Start Now to help me help families talk about having constructive conversations with their aging loved ones about aging life. This is a series of discussions, and the timing and the prioritization of topics is unique and specific to each individual and their family. There's a series of topics of conversations to have. Home safety. Talking with your loved ones about how long they want to stay in their current living environment and have the ability to age in place. It's a good idea to have an occupational therapist, a physical therapist, a contractor that has a certification in aging in place to come and look at the home and make suggestions and recommendations to your loved ones about fall prevention and what they can do to help keep them safer at home. A transportation plan, perhaps one of the most difficult and sensitive conversations to have with our aging loved ones. And please, don't wait until it's time to ask your mom or dad to sell their car or to hand over the car keys to talk about transportation. Instead, start early and talk about a transportation plan. Find out where they go every week. What are the things that are important to them? Their errands, their hobbies, their doctor's appointments. And gather a set of resources, individuals that can help assure that they can get to their appointments safely and happily, and that they can accomplish the errands that they need to. Accounting. Talking with your loved ones about monthly financial management is also a very sensitive topic. However, if an emergency happens, a crisis occurs, someone needs to know where the bank is, where the banking records are kept, how the household bills are paid. If your loved one is tech savvy and has usernames and passwords, where are those kept? And ask them if they're willing to share that information with one trusted individual. Another topic is recreation and fun. Joy is what gives us quality in our days. Talk to your loved one about the hobbies, their spirituality, recreational opportunities, what gives them daily joy, so that you can help them continue to have that even after a crisis, a medical diagnosis, even as dementia progresses. Technology. Technology is a topic that has never been more important than in 2020. And what we've learned through COVID is that technology can help us check in on our aging loved ones and be assured that they are safe. I'm not talking about cameras and microphones in a home spying on our loved ones. I'm talking about passive technology that's a series of sensors that gives us reassurance that our loved one is going about their daily habits. And if they're not, then a loved one will get a message and can check in on their loved one. There are many technology experts that are available to offer a complimentary consultation to offer you suggestions about how technology can help you keep your loved one safe and living the life of their choosing. Nutrition. It's very important to understand the food that people enjoy to eat. As we age, food becomes even more important. We need to understand dietary restrictions, how they get their food, and are they eating a nutritious, balanced diet. Outside experts. Now is the time, in a prevention mode, to gather a team of individuals that you can call on if and when there's a crisis. Reach out to a home care agency and have a conversation with the nurse. Get information about hourly rates, schedules, availability of caregivers. And even if your loved one is willing, establish a very light schedule where your loved one and a caregiver can begin to develop a rapport and a relationship. So that in the event of a fall, a hospitalization, an emergency, you already have that relationship in place. And last but not least, who, where, and when. We need to know if our loved ones have put into place their advance directives. Is there a financial power of attorney? Is there a healthcare power of attorney? Is there a living will, a trust, long-term care insurance? All of this information is so important, and I promise you, so hard to collect in the midst of a crisis. And if you find out that your loved one doesn't have these documents in place, it's very important to work with an attorney and get those documents in place. So these conversations obviously are sensitive, confidential, hard to start, hard to continue, and so the selection of participants is very important. I cannot tell you how many times I have walked into a family home with the goal of facilitating one of these constructive conversations with an aging parent and an adult child, only to walk in the room and find mom and dad sitting on one side of the living room, and the adult child that I know, their siblings, the in-laws, and maybe even a grandchild or two sitting on the opposite side of the room. This is not a conversation that will easily go well. Select the participants, keep it to a minimum, make it the people that are pertinent to that particular topic. Location, location, location. It's more than a real estate term. Where you choose to have these constructive conversations is very important. You need to be in a private space. This is confidential information. If someone has hearing problems, it's good to be in a quiet space. Sometimes it's comforting and reassuring to have a conversation in your loved one's home. Other times, if you think the conversation is going to be a bit contentious or difficult, change the setting. Perhaps invite mom over to your house for a cup of coffee at the kitchen table and keep it as informal as possible. Please remember that these are dialogues. I know in my own family, sometimes I've had to physically zip my lip so that I'm assured of listening to my loved one. Sometimes we're so busy thinking about the next thing that we're going to say. We're nervous, we're anxious, it's a sensitive topic, and we just want to get it out of our mouth, that we're not giving our loved one the respect or the time for them to have input into the conversation. One great way to assure that you are actually hearing and you're demonstrating that you're listening is to be quiet and then repeat back to your loved one what you just heard them say. And these constructive conversations are much different than family meetings. I think of a family meeting as something like this. Mom and dad have called all of the kids and the in-laws together to announce that they've decided to sell the family home and they're downsizing and moving to a retirement community. Or perhaps the family is called to an attorney's office to sit at the conference table and review legal documents. These constructive conversations are much different than that formal setting where people don't have the opportunity to provide input, questions, and feedback. So as you go into your caregiving journey, it's very important for you to look inward. It's probably neither wise nor fair to count on your own family to be the source that you go to vent or be angry or cry. Identify your own support system, people that you know, love, and trust, that you can let your hair down with, that you can vent, you can cry, you can ask for advice. And never has there been a time that's more important for self-awareness. I know that when I was looking after my aging father, I felt like if I was Superwoman, he would be okay. and I just about ran myself into the ground. So it's important to be self-aware enough to understand what is realistic for what you can do, and then to build a caregiving team to support you as the primary family caregiver. Dedication to the greater good and emotional maturity, great terms, hard to do, even harder to go the distance. It's so important to us as caregivers to do a good job and to be everything to our loved one. Again, caregiving is not a solo sport, and you need to build a team, a circle of support to help you. It will help you with your stress, your anxiety, and it will help keep communications less emotional and more positive. Caregiving with parents. It's important to acknowledge the past. Probably not one of us had the perfect childhood, nor the perfect parent. However, now is the time to focus on the present. If your loved one, if your mom or dad is living with a dementia diagnosis, it's important to get some education and to understand that your parent, as their disease progresses, they may not even understand that you are their adult child. They may picture you as a younger person and they don't recognize you. So focus on the present. Take no out of your vocabulary and try hard not to ask the question, don't you remember? Because they don't. Plan for the future with your mom and dad. Even if a crisis is already in motion, the short-term plan that you've implemented does not have to be your long-term plan. We all have jobs, we all have lives, and so it's important to reach out to experts for guidance and support and for a care plan for the long run. Siblings. I love this quote. Our siblings push buttons that most of us felt that we let go of long ago. The baby, that was me, the peacekeeper, the caretaker, the avoider. It doesn't seem to matter how much time has passed or how far we've traveled for those old roles to kick in. I wrote a blog post one time called Sibling Rivalry and Running the Emotional Gauntlet. I came up with 5 tips to partner with siblings during an aging parent crisis. The first is hope for the best and expect less. Respect legal and fiduciary assignments. About 2 weeks ago, I had a client, a daughter. Her mom had been in assisted living, fell, broken her hip, been in the hospital, and is now in rehab. All of this during COVID. My client has a sister who is named as the healthcare power of attorney and the financial power of attorney. My client is upset with her sister. She's upset with COVID. She's worried about her mom. She can't get into the facility to see her mom. She says that her sister doesn't ask the right questions of the medical professionals. When she calls the nurse's station, she's told that they can't give her any information because she's not the POA. She can only see her mom through her room window. She's worried, she's scared, and she told me that she had come up with a plan, that she's calling an attorney and that she's going to ask that attorney to redo the power of attorney to add her as a co-POA. And then somehow that attorney is going to get to mom and ask her to sign those papers so that she can fill the role that she feels she needs to. I asked my client if she'd be willing to sit and talk with me and consider an alternative. I pointed out to her the challenges that we're facing right now in COVID, when the lawyer couldn't go in to see mom in the facility, that mom is working hard right now in rehab to rebuild her strength and stamina, that her sister may be willing to sit with me and with my client and have a respectful conversation and clear up the misunderstanding about what questions the sister has that are not being answered. I also asked the sister to consider what the nursing staff is going through at the facility right now, and that for every family member that calls that phone every day, it's that many minutes that's taking that staff away from direct patient care. So she agreed. She was willing to sit with me and the sister, and we came to a peaceful conclusion that leaves the documents in place for now and has saved time and stress and probably some money as well. And now the sister's getting the information that she needs. The POA has called the nurse's station and asked for the nurse to provide information and acknowledge the sister as someone that's on the HIPAA authorization. This is my favorite tip. Jobs for everyone. We're all good at something. So, a personal story, many, many years ago, my mom was in the hospital having had 2 major surgeries. I have a brother and a sister. My sister and I took turns staying with Mom in the hospital night after night after night. We decided that it was time for our brother to step up and do his time in the hospital at night. Now, my brother's a wonderful man. He's not a medical person. He's not a caregiver. He was scared to do this. He was scared he'd do something wrong. The night that he stayed, my mom didn't sleep because she was worried about my brother. My brother didn't sleep because he was worried that he was doing the wrong thing. Looking back now, I realize that would have been a better solution for our family is to have asked my brother to do a job that plays to his strengths. He could have done a Care Bridge site to provide daily updates on a website to help us field the many, many calls that we were getting from neighbors and family and friends. He could have taken our dad out to eat or done some cooking and meal prep or run errands for him. Another tip is practicing self-care. Self-care is probably one of the biggest pieces of advice that caregivers hear over and over again, and it's frustrating because they don't know how to find the time and space to do that. It is so important, though, to acknowledge your limitations and when you're getting burned out. Burnout is a time when tempers flare, stress is high, and things are said that you wish you hadn't. Go for a walk, drink some water, find a caregiver and take a couple of days off. Get a good night's sleep, whatever it takes for you to find that respite that you need. And last but not least, now is not the time. So many siblings have some unfinished business with one another from childhood. And when everyone's tired and worried and scared, it could easily be a time when we become our least best selves and we pick fights and arguments and we criticize one another. And it's not helpful. It's much better to say, now is not the time. Selflessness is a good look on everyone. In this beautifully complex world of ours, there are at least 7 types of families: nuclear, single parent, extended, childless, step or blended, multi-generational, multicultural, where perhaps a grandparent is the patriarch or matriarch of the family. It is important for all of us to understand that we come from different pasts and that our loved ones, our aging loved ones, have different expectations of us. In some cultures, for example, the idea of bringing in outside help to hire care to look after our cherished loved one is not accepted, was never done in the past, and that we may be shamed or criticized by others in our family for bringing up that suggestion. There are ways that we can broach this topic and look at what the pros and cons would be to support a young family that's looking after an aging grandparent, aunt, uncle, or parent. We're in a different world now where husbands and wives both work. Children have to be cared for. During COVID, there's an added responsibility of homeschooling. And so to try to be all things to everyone in our family is simply not possible at times, and it may not allow us to give our loved one the very best of care that we wish for them. And so working closely and talking with the family to explore what type of caregiver, what personality, what types of responsibilities or tasks might be willing to be accepted by the family, to give the family some respite and to assure that that loved one gets the very best of care. So in my work, everyone's an individual and everyone's circumstances are unique. Yet I learn from every family. They teach me a lot. And so I thought I would share with you a few of my client stories and hope that they will help you in your caregiving journey. Matt and Mary were a blended family. They were in a second marriage to one another. Their children were raised separately. Matt had 3 kids, Mary had 1. The children played together, shared holidays sometimes, saw each other routinely. Matt was a gentle giant. He was the strong patriarch that taught love among all the family members. The kids grew up, left home. Sadly, Mary was diagnosed with early onset Alzheimer's in her mid-years. Matt and Mary's daughter became even closer as they worked to support Mary as her dementia progressed. Even more sadly, a few years into Mary's journey, Matt was diagnosed with Alzheimer's. And that's when things started to fall apart in this family. With Matt no longer being able to be that strong patriarchal figure, the children stopped respecting the fact that Matt and Mary were husband and wife. Matt's kids picked him up and moved him to another state where he used to live and placed him in memory care. Neither Mary's daughter nor Mary knew where Matt had gone. Mary started having behavioral challenges in her family care home. She packed her bag every day. She couldn't sleep at night. She wanted to know where her husband was. Well, Matt's children wouldn't cooperate. Mary's daughter was doing everything she could to bring the two back together. The lawyers got involved, the court system got involved, and a professional guardian finally reunited Mary and Matt. And the good news is that they were able to spend the last years of their lives back together in a family care home. Sadly, all of the actions that the stepchildren took had led them down a path that was a dead end. The hard feelings, the money that was spent, the actions that were taken led to a family that is no longer together. Jim and Jane. Jim and Jane were the light of one another's lives. They never had children. They had one niece, and she came to the caregiving plate to support Jim and Jane when Jane was diagnosed with Alzheimer's disease. Unfortunately, the niece had no way of knowing that shortly after this that she would be hospitalized not once but twice with a very serious illness, and that she was physically and emotionally not able to do everything that Jim needed. Jim had promised Jane that he would keep her at home until the end of her life. The niece reached out to a care management company, and the care manager was able to help Jim find caregiving support that fit into his budget and into the care plan and his wishes for Jane. And Jim was able to fulfill his promise to Jane, and he did keep her home until she passed away. Sam and Sue, been married for 62 years. They have 3 sons. One's local, lives a few miles away from the home. His 2 brothers live out of state, each one in a different state. This family's taught me a lot about great communication and family. These sons, their parents did everything right. Sam was diagnosed with Parkinson's disease, and along with that came frequent falls, and along with that came frequent hospitalizations. Sue had stood firm that she was going to care for Sam and keep him at home for the rest of his life. The sons saw the toll that this was taking on their mom. She needed to have surgery, and she was refusing to do it. She was neglecting her own health and well-being. And these sons came together. We worked over the magic of Zoom, because, again, this happened during COVID. And these sons taught me how you can make a care plan and implement it using Google Sheets and meetings over FaceTime and Zoom to make sure that mom and dad got the help, the assistance, and eventually an assisted living community that could support Sam's needs and allow Sue to get the surgery that she so badly needed. I love this quote. The principle needs to be this: whatever the reason for your feelings, you will have to find civilized solutions. It takes a village. We have so many wonderful local community resources that caregivers can take advantage of at no cost to them. We have Triangle Guiding Lights Caregiver Support Center that can help caregivers with their stress, with their confusion, with the new tasks and skills that their healthcare providers are asking them to fulfill. We have Dementia Alliance of North Carolina that can listen and support and provide resources for people on that caregiving journey. The Center for Volunteer Caregiving offers volunteers that can provide a little bit of respite for those weary caregivers that just need some time away. These resources can help you from speaking sharply or yelling or getting angry with your loved one that's living with dementia and doesn't know and can't help what they're asking over and over and over again. I also recommend caregiver support groups. I facilitated a support group for caregivers for about 2.5 years, and I used to say, all I did was bring the coffee and keep an eye on the clock. These caregivers were the most beautiful source of support for one another. They dried each other's tears, they held each other's hands, they gave important advice. Someone that was further down the caregiving path with a spouse that's living with dementia could advise someone whose spouse had just gotten a new diagnosis. And even during COVID, while we may not be able to have these caregiver support groups face-to-face right now, they've gone online through the magic of Google Duo and FaceTime and Zoom, and they have become such an important, even more important source for caregiver support that where they used to be at monthly meetings, now sometimes there are support groups that you can attend virtually that meet weekly. It's a source of support and allows you to vent and to cry and to ask for help. Other resources that might be helpful to you are the Triangle Aphasia Project, memory cafes. And nationally, there are more resources. The Alzheimer's Association. If your loved one is living with a diagnosis like multiple sclerosis or Parkinson's, there's a national foundation or another charitable organization that has a 1-800 number and people that you can call and get advice and resources and support and simply a listening ear. AARP is a robust website with so much helpful information and easy to take advantage of. So in final thoughts, caregiving often calls us to lean into love that we didn't know was possible. This is from the book, The Inspired Caregiver, Finding Joy While Caring for Those You Love. A few questions that we receive frequently from families that call in. The first is about home care. A loved one has a parent that has moved in with them, and they thought that it was a great idea in the beginning, and now they realize that it's infringing on their spousal relationship, their relationship with their children, and the household routine has been turned upside down. What can we advise and what can be done to help? So we suggest a few things. It's important to identify and bring in some home care that a loved one will accept and will allow you to have some time and space to run your errands, to have some special time with your children. And the best way to identify that home care is simply to call a couple of trusted agencies. And that's where your community resources for seniors of Wake County, for example, Triangle Guiding Lights, Dementia Alliance, can give you the names of some vetted home care agencies that you can trust and call and explore the cost, the hourly rate, the minimum number of hours, and the types of activities that they could do with your loved one. Another suggestion is respite care. Many people don't know that assisted living communities will offer a short-term respite stay so that you and your family can get away for a couple of days or attend a family event. Another suggestion is hospice care or palliative care. This is something to discuss with your loved one's doctor, healthcare providers, and to explore whether that is an additional set of resources that not only can provide care and support for your loved one, but also for you and your family through a social worker, a spiritual counselor, a home health aide, a nurse. Another question that we're frequently asked is when to call in hospice care. Hospice invokes fear and anxiety in families sometimes, when in fact it can be such a valuable resource to your loved one and to your family. Hospice means giving your loved one the best quality of life for their remaining days. It doesn't mean that it's caregiving that's called in the very last hours of life. Palliative care is one step before hospice care that's also offered by hospice organizations. And that's an additional set of eyes from a healthcare provider that's checking in on you, your family, and your loved one to be sure that they're getting all the support that they need. These services come at no additional cost to you because they're covered through your Medicare benefits.